Good morning. I'm Lacey Nobles with the City of Lubbock. Our news conference will start in just a few seconds.
All right, checking in.
Thank you. Good morning, and thank you for joining us for the City of Lubbock COVID-19 news conference. I'm joined by our panelists today, Director of Public Health, Catherine Wells, Local Health Authority, Dr. Ron Cook, and Lubbock Mayor, Dan Pope. Today, we'll have updates on coronavirus in the community, data analysis, information on the upcoming school year, and then we'll open it up for media questions. So let's get started with Catherine Wells.
Good morning, everyone. I want to give everybody an update on our current COVID case counts here in Lubbock County, and then also talk a little bit about what to expect as we're looking at reopening schools and moving into the fall. The health department is reporting 5,255 cases of COVID-19 as of yesterday evening, and of these, 3,186 are recovered. 1,994 are active cases. And then unfortunately, we now have 75 individuals who have died from COVID since the beginning of this epidemic. Although these numbers are still high, the department has seen the average number of reported new cases decrease a little. Other indicators such as the number of phone calls and requests for clinic appointments have also declined. These are all good signs that the amount of virus circulating in the community is declining. And this is where we want to be prior to moving into the school year. As I have said before, controlling the spread of COVID requires the entire community. We need to be smart when we're out, follow the Lubbock Safe guidelines, practice social distancing, and don't forget to wear that face covering. I really think seeing so many people wearing a face covering out there is really contributing to the lower case counts that we've seen over the last couple of weeks. The health department's also receiving multiple calls and emails from family, teachers, individuals that are concerned about school reopening. The health department and city leadership have been in constant contact with our universities and our local school districts. And I'm really impressed with the plans that I'm seeing coming out of these entities. We are working with these entities, schools and colleges to make sure that we have the most safe environment as possible as we start bringing people back together. We do expect to see some COVID within our schools. I can't honestly say that there won't be any COVID cases in any of our schools. However, we think that when we have cases within a school that we're going to end up having to close some classrooms, and we're going to refer to these as micro closures. And that means that if there's a case or transmission within a classroom, we will quarantine that classroom and allow the rest of the school to open. And then after the quarantine's finished, those children will be able to return to school. But we want to make sure that parents and employers are really prepared for these types of things happening. We're going to have to be flexible to get kids back into these buildings. We're going to have to work together, follow social distancing, wear masks, do everything we can to allow the kids to return to school. With that, I'm going to go ahead and turn everything over to Dr. Cook.
Thank you, Catherine. Happy Wednesday to everybody, too. So we believe, everybody at the health department, many other individuals believe that it's important for our students to return to school. Our students need those social interactions. Our teachers love to teach. That's why they're teachers, and our teachers need students. There's something that's been picked up in the educational literature, and it's called the COVID slide. And that really describes the regression of learning skills, and because the students haven't been either in person or actively involved in a learning process. So their skills slide backwards. Now, we see this in the students that are in the greatest risk among this group are those students that are already educationally at risk or socially at risk. They don't have the support at home, or they're already a little behind. And so that gap just continues to increase when they're not interacting with their teachers at school and their friends at school. We believe that the benefits to returning to school outweigh the risk for returning to school for infection. And we also believe that it is an individual choice. And most of the schools that I've visited with have plans to return to school in person and have plans to do school online. And that's an individual choice. And I think they have worked hard trying to create learning opportunities for both venues. So how do we return to school and be safe? Please note, let me reiterate what Catherine said. I do expect the numbers of COVID infections to increase. Our goal here is, again, to make sure that we don't overwhelm the hospitals with the need for a hospital bed. We cannot make schools completely 100% safe, but life is not 100% safe. We know that, but we believe that opening schools is a must. How do we do that? I know that the school districts that I'm involved with here in Lubbock and in Cooper and in Friendship all have spent many hours strategizing how to best serve our students and keep them safe. I know of no one that wants to do this just to open school and be irresponsible about students returning to school. They have spent many hours. How do we reopen the school buildings? And how do we keep them open? And how do we operate and return to teaching safely? I know that the plans that they have created include masking all teachers and all staff and all students that come, and that they have hand washing stations and sanitizers in the school building, and opening up different ways to access the school building so that you don't have crowded people trying to fit through one entrance. Limiting large gatherings of students, like going to the cafeteria. They're going to stagger that better, and not going to have the big assemblies in the gymnasiums anymore, and just avoid overcrowding in general. And even perhaps staggering the times that certain groups return to school in the morning. I know that there are plans that have things to do with prioritizing cleanliness and ventilation and air filtration and reorganizing the classrooms to make sure that students are socially distanced. I saw one good example on social media where a teacher had taken PVC pipe and built a box frame and hung clear shower curtains in between 4 desks. So each quadrant of students could sit next to each other, but have a clear shower curtain separating those individuals so they could see each other, they could talk to each other, but there's a clear barrier in between. I thought that was a wonderful idea. And our teachers are exceedingly innovative and bright on how to come up with ideas, how to teach. I can't tell them how to teach in their classroom. They're the ones that live in the classroom, and I know that they want to protect their children, their students, as best as possible, yet deliver their educational message on a daily basis. They have spent lots and lots of time doing that. Our children are going to do very well in school. Our children are going to fare, even if they get infected, for the most part, are going to weather this infection very, very well. There are some that may not, and I think that's a discussion you need to have with your pediatrician or your primary care physician. My biggest concern is that when a child gets infected, a student becomes infected, my biggest concern, of course, is for the child or the student, but also those people that they live with. Do they return home to a vulnerable population? Is there a grandmother that's ill, or a grandfather that's ill, or other family member that has significant illness? So my suggestion for you individuals that are listening and parents that are listening, as soon as your student gets home, ask them to wash their hands and wash their face, even perhaps change their clothes so they don't bring that inside the house, or immediately take it to the laundry room if that's possible. So change clothes when you get home. Consider facial coverings, even in a household, for those individuals that are potentially at high risk or vulnerable. All this to say, we must continue. This is a marathon. We're learning every day. We may change our mind on how to do things. And as Catherine said, We may have micro closures of a classroom, parts of a facility until it can be cleaned and disinfected and safe to return. It's a marathon. And I know that Lubbock can do this. We're already doing it. And I think if you look at our numbers, we've reached the peak and we're kind of heading downhill. It may bounce up a little bit, but I know that we are capable of solving this problem. Again, keep practicing those Lubbock Safe guidelines. Wash your hands, wear your facial covering, and keep practicing social distancing. We can do this. I have great faith in this community, and I know that you guys can do this. That's all that I have. Let me hand it off to Mayor Pope.
Thanks, Dr. Cook. I'm starting this morning with my thank you mask. I want to make sure that you hear from me. Thank you. I want to start with that, and I'll make my point about it later. But I want to thank the citizens of Lubbock County and the region for taking this seriously. And I'll get back to that in a minute. But thank you. Let me share some data to start with this morning. Give me just a moment to pull share my screen. Okay. Remember that the data I'm showing is available on our website. A couple of things I might mention about our website. You're going to see a few different slides today. We're not hiding anything. It's all still there. There's also a how to dig into, if you want to dig more into the data, there's a how-to video on our social channels, as well as on the website, so you can figure out how to do that. We know that the new dashboard that we're using does not work as well on mobile devices as we'd like it to. We're working on improving that. So we've heard you on that. That's something that's on our to-do list. So our cumulative count to overall count. So this is one of the two slides that I watch every day. This is our 14-day rolling average positivity rate. So the trends go in the right direction. The overall trends go in the right direction. Most importantly, if you look back 3 weeks ago, this had gotten up over 15%. You remember that for a long time, it was in single digits, low single digits. That's, we want testing. By the way, if you feel like you need to be tested, go get tested. It's free. Test free at Rogers Park Gym. Test free at Patterson Library this week. Next week, moving to the Combest Center. Please get tested. The testing is available. Age count of new cases over the last 14 days, still weighted towards the younger part of our population. And then hospitalized patients. Now, this is a different look than you're used to. This shows just our ICU trends. You can see what we talked about last week, that we found a sort of a range here where this is operating. There's a couple things that I want to make sure that I mention about this. Our hospitals continue to serve a much larger area than normal. It's not just West Texas and Eastern New Mexico. They're serving many other parts of our state. I'm proud of them. Serving a COVID patient is not a money grab for a hospital. They would much prefer to do cardiac work, neuro work, or elective surgeries like hips or knees. They're serving their mission when they do this, and I'm very thankful for their willingness to continue and keep their doors open while safely serving, most importantly, the citizens of Lubbock and West Texas. Okay, now let me start by expressing my sympathies to the families that have been impacted by COVID-19. Those 75 deaths are significant. All of the deaths in Lubbock County have been people over the age of 50. and 3/4 of them have been over the age of 70. However, that doesn't lessen the impact of those lives. So it's important that I recognize that. I also think it's important that we recognize those businesses that have been and families that have been impacted by this, whether you own that business or you work in that business. That's heavy on my mind, and certainly the city council. I also would like to find a way to safely partially reopen bars, and I know that there's some efforts along that line. I think the TABC has been responsive to some, I think, creative thinking, and we think they've been a good partner. Let me move to the school topic for a minute. Earlier today, I had a chance to participate on a weekly conference call or video conference with the South Plains Association of Government. They coordinated. It's for mayors and county judges and city managers, city administrators. And today we added school superintendents to our call. And I was joined by Kathy Rollo, Michelle McCord, and Keith Bryant, the superintendents of Lubbock ISD, Friendship, and Lubbock Cooper. They're great partners, and they laid out their plans for reopening, and we're open to questions. I think it's important to call out the fact that summer school is going on, not only K-12 summer school, but also at Texas Tech. So there's an effort to practice. I think our other schools are too. That's two of top of mind for me. We're going to have to be flexible. Opening school is not only important to students, but it's very important to our families. Our families rely on schools to not only educate their kids, but to provide a safe, nurturing place for their children while they work. And that ability to send kids to school allow them to go to work and put bread and butter on their table. And I think we need to think about that. I'm thankful for the way our school districts are communicating. Their websites are very well done. They're having parent meetings. Texas Tech is also a great example of that. I've not had a chance to look at everyone's website in higher ed. I know that I've had some conversations with LCU. They're down the road on this too. We have great partners. I have had a little chance to travel in the last 2 weeks. I've been places outside of West Texas. My big takeaway is this: the common sense of West Texas people has allowed us to reopen and re-engage our lives much more than the bigger cities in Texas, and in many cases, the states around us. It's not normal. In fact, I've tried to take normal out of my vocabulary, but I believe that we've been able to safely and sensibly re-engage our economy and our lives. We've got to continue to do that, but we have to do it safely. We've got to imply that common sense every day. Okay, that's wearing your face covering. That's washing your hands. That's keeping your distance. It's not hanging out with people that you haven't been hanging out with. Okay, that's difficult, but we need to stay the course on that. So let me end where I began. Thank you. Thank you for being West Texas strong, for being Lubbock strong, for showing that horse sense that we're so well known for. That is what will let us get through this. It's not going away. We're going to have to coexist with this virus. We can do that safely. Let's please stay the course. Continue to be hopeful. Continue to be safe. Continue to be kind. Lacey, back to you.
Thank you, Mayor, and thank you to our panelists. We're going to open it up for media questions now, and our order today is the Avalanche Journal, Latino Lubbock, KLBK, the Daily Toreador, El Editor, Texas Tech Public Media, KMAC, Fox 34, and KCBD. So let's get started with Matt Dotre from the Avalanche Journal.
Good morning, everyone. Ms. Wells, will you please talk about testing and contact tracing in schools? Like, will there be mass rapid testing available to entire classrooms?
Sorry, I was on mute there. With contact tracing within the schools, it's going to be a coordinated effort between the health department and the nursing staff at the schools. So it's going to be a constant communication from the school nurses to tell us if they have a positive case, so that we can provide those recommendations on what to do with that school versus, and then also the health department talking to the schools if we find any positive students or teachers. We've had positive cases within daycares here in Lubbock, and we've been able to close classrooms and not see spread within the rest of the facility. And I think that's a good sign to show that when we're wearing masks and working together, we can really stop the spread outside of, beyond the classroom.
Like, will the nurses be providing testing, or will the health department be coming in to provide testing?
We don't have plans right now to do like strike teams within schools. If there was a surge of cases, there are ways that we could do that, possibly we've trained our firefighters now to do the COVID testing. So if there was that need, we could provide it, but it's really going to wait and see if there's an outbreak, then we would respond.
Okay, thank you. And Dr. Cook, I wanted to ask you, I think at one point you said you were the health advisor for Cooper. So I kind of want to ask you in that role, like what would your advice be to parents who are at high risk as they're trying to decide if it's safe to send their child back to school?
You know, Matt, that's a great question. I've had that question a number of times, and it's an individual response. We lay out the scenario, we lay out the options that each school has for that particular student's environment, and then it has to be a decision by the parent to decide whether or not they will send their kid to school. I've had some that say, okay, that sounds good, we'll send them. I've had some say, well, no, I may wait 9 weeks. It depends on the school. Some schools say it's in or out for 9 weeks. Some people say, okay, we'll try it a few weeks, but it's up to the individual school and the teachers in the classrooms and the principals. And so you lay out the scenario, or the school can lay out the scenario for the students and the parent to decide this is how our safe environment looks, and it's ultimately the parent's decision. So all of those are the whole goal is to protect them as best as possible.
Thank you, everyone.
Thanks, Matt.
Okay, thanks, Matt. Now we have Chrissy Martinez Garcia with Latino Lubbock.
Good morning, everybody, and thank you for your time. Who knew we'd still be dealing with COVID into August? But Dr. Cook, you talked a little bit about what families should be doing to prepare once the children arrive from their day at school. But something, as you know, there's a lot of grandparents that are raising grandchildren, and you touched on it a little bit. Here's the thing is, with a lot of Hispanic families, for example, they're still dealing with issues of language barrier. That information's not being provided bilingually. And they also are dealing with the lack of internet or Wi-Fi, and partially because they're low income. So, how are we going to work to make sure that we're providing those families, and my focus is these grandparents, to get them that information. Hispanics are they have multi-generational families living in a home. So what are we gonna do to make sure that they're being reached?
Well, that's up to each school and classroom and teacher and principal of that institution. So thank goodness we have grandparents, right? Thank goodness we have grandparents that can help us learn, and they're such a resource for families. That's a difficult question, Christy, and so that's a conversation that needs to happen with the classroom teacher and the parents or the grandparents.
But let me just tell you this, sometimes, even in the classroom, they have a hard time connecting these families. So, I mean, I'm giving you or encouraging that we look into that, because I think it's going to be very important. And as you know, the first person that comes back into the household is not the one that develops the symptoms. Sometimes it's those that they come to that are being infected. So, something to think about.
That's Christy. That's my whole point from a medical standpoint, and that's where I'm the expert.
Mm-hmm.
I am concerned that some children may bring this home to their caregivers who are the grandparents, and so I do have concern, and that's why I recommended that they really wash their hands and then scrub them down and perhaps change clothes, and even wear a mask around. I know that sounds a little weird, but if you're trying to protect the grandparents, that's probably the best thing to do. But as far as the educational process and having materials available bilingually, that's a conversation that's out of my realm of expertise, but certainly having that conversation with each classroom teacher.
Hey, Christy, let me add on. You made a really good point about the connectivity. And one thing I would encourage parents or grandparents, whoever is that guardian of or guardians of that child, that student, if they do not have connectivity in their home, they need to be working with their students' principal or with the central office. I know Lubbock ISD, and I believe the other districts have the ability to provide free wireless hubs for the learning effort, whether the kids are going to school in person or online. I believe those are available, and I would encourage them to reach out to the principals.
Very good. My next question is, as you know, we continue to coexist with this pandemic, and still in the first wave, we are now hearing of a lot of families that they didn't apply for any programs because they thought we're going to be done with this. And we even have some business owners that have been slow and they've had to cut hours for their employees. So will the city be receiving any additional or applying for any additional CARES funds? And if so, will there be opportunities for those now feeling the effects of COVID-19 and in need of that assistance?
It's a good question. As you probably have, many people have followed what's going on in Washington. They're debating I think a fifth response to COVID-19. But would be much more like a CARES 2. It's got a couple of different names. I don't know what they're going to end up calling it. I think one is Heals and one's Heroes, depending on the House or the Senate. We hope that there's funding there. We certainly know that there are families and businesses that are hurting. Our funds, as they have been given to us today, as well as funds that we took off out of our savings account, as well as privately raised funds, have been committed. We've held back about 15% of the original CARES dollars for the long term. I think it was, when we did it, we didn't know how long it was going to be. Right now, we feel good about holding that back, but we'll see. It's certainly, we're advocating as we speak with the governor to relax some of the requirements on the CARES dollars that we received. As you'll recall, we received about 14 million. Only 3.5 million of that was eligible for direct support, so families or businesses. That's not the way that the act or the money was given to the larger cities and counties in the country. Those over 500,000. We'd like to, for that, we'd like to see those original dollars freed up a bit. We continue to work on that, but we'll keep you posted. Right now, the answer is, what we have, we've gotten out to families as quick as we can.
Let me just ask one more question for you, or it's not even a question, it's more of, we have some tools, a newspaper, a website to help you, because, at times it's difficult to see that. I feel like there's still a lack of cultural competency. So let us be a tool, for you, okay? Thank you.
Thank you.
Thank you, Christy. Now we go to Terry Furman with KOBK.
Good morning, everyone. My question is this: with over 5,000 cases now that we have we seen anyone coming back and being tested and seeing COVID-19 for a second time, being positive for it a second time?
Terry, as far as I know, we have not. I wouldn't. Two things we never say in medicine: never say never, never say always. So we hear anecdotal experience in different places that might be possible. Given that our antibody production may not be lifelong, maybe relatively short-lived. So it may be much like the flu that we can get it again. So certainly wouldn't hold my breath on that. So.
For sure. And I just wanted to follow up. I had a viewer ask about if the amounts of deaths that we're seeing, are all of those deaths people from Lubbock County?
Yes, the deaths that we report at the health department are individuals who are residents of Lubbock County. If somebody dies in an area hospital that's from out of area, that number's transferred to their county.
Okay, just making sure. Yeah. Thank you.
Thank you, Terry. Now we have Mateo Rosales with the Daily Toreador.
Good afternoon. So I have two questions for today. As we know, the students for Texas Tech and for a lot of other universities and colleges are about to start making their way back to their housing off campus or on campus starting the 1st or the 8th. Are there any predictions on how bad the COVID cases may rise with the transition of college students coming back to Lubbock?
No, Mateo, we don't. There is great concern, right? I mean, we're going through a lot of work on the main undergraduate campus and as well over here at the Health Sciences Center to make sure that we mitigate the spread of infection in any way possible. We do expect our numbers to rise, our infection rate to rise a little bit, but we have lots of plans, lots of hours that are ongoing to help mitigate the spread of that virus.
Okay. My next question is, as Mayor Pope and you, Dr. Cook, have said, that Lubbock has a lot of guidelines and policies involved to help mitigate the rise of COVID-19 cases and make sure that we can stay open as long as possible. But is there still a chance that, as we saw with the bars opening and the COVID cases rising, is still a chance that with the rising COVID cases from school openings, that Lubbock will have to shut down again?
Well, I think, we don't want to answer. I don't want to answer a question around a hypothetical. I mean, you guys have asked that question before. I mean, I don't think so. I mean, if you ask me my opinion, but what I've learned is a little bit about what Ron said a while ago, whether there's no always or never in this deal, and we'll adjust and make decisions as we go down the road. We think that what we've got in place today gives us the best chance to safely coexist, to safely re-engage. And we encourage people to stay the course. Wear your face mask or face covering, wash your hands, keep your distance, try to stay in the same groups. Don't. If you're a social butterfly, you need to be a butterfly within your little group. Okay. I love the interpreter. I need to say butterfly again. Let me say that one more time so you can see how butterfly makes Alicia smile.
Thank you.
Okay, thank you, Mateo. And now we have Olga Guerra with El Editor.
Good afternoon to everybody, and thank you for all your services. Just to sort of re-say what the mayor said, our condolences to all of those people that have passed, and I hope it slows down the process. But it's also sorry too when you have friends that called and say their feel of the situation. And some of the sad things that we hear is, a caregiver not wearing a mask, around this person that passed. I would think those would be the first ones that would be extra careful. And I'll leave it at that. The first question will be, I guess, to the health department or to the doctor. We talk about these recoveries, and if y'all can maybe let us know what are the lingering symptoms of a person that's considered a recovery. I mean, since they are tested to see if they're negative or positive right after they recover, we don't know if they have those antibodies still or how effective they are. And for all we know, they might be considered at one time or another or correct us as spreaders because the virus is still in them. So if y'all could sort of deliberate on that.
Hi, Olga, that's a great question, and it's good for people to know. So there are many reported cases. So we expect antibody production to rise about 2 weeks since you got infected. And so it takes about 2 weeks to develop antibodies. The results, or you may continue to shed virus even after that. Now, if you have antibodies, it's our thinking in the medical field that after a couple of weeks, and you have antibodies, that even though you may be shedding virus, it may not be virus that's infective. And we have had a number of cases that continue to shed virus for 6 weeks or so. And that's why we don't do testing to return to work. It's our opinion that we don't require a negative test to return to work because you continue to shed virus. And we think that virus is not infective. The symptoms that can occur or linger on are profound fatigue, shortness of breath, and heart issues. And there's some kind of brain fog sometimes that continues and may linger for a number of days, if not a few weeks after a COVID infection. Not everybody suffers those. Not everybody suffers all of those, but at least some people may have some of those or parts of those. That's a great question, Olga.
Thank you, doctor, for your answer as well. I'll touch a little bit on LISD. There have been some expressions and some concerns within the school population, both teachers, parents, and students. And they do not want LISD to be in the same situation as Lubbock or Texas, as for opening too soon, too fast. Believe me, everybody wants to go to school. There is not one person that I can tell you, or you can tell me, they don't want the schools to be open. They don't want to go back to school. But when you hear about, you're needing to, we're going to be expecting numbers, but it's sad to know that we have to put our children or our teachers in that situation that you got to go test the waters. Those are the concerns that we hear out there, and that's why we are expressing it. And with that being said, I don't know, and that's a question, if there's been any positive during the school summer session. It's, yes, Mayor, it's a good process of practicing those, but has there been any, and has there been any testing? Touching on temperature checks for the children. I don't know the expression, but people are saying, do we not have time? Are we not making time for our children? So if they're not taking time for their children before they walk into the doors, what is there to say, will they take time inside to take care of our children? This is not I saying this is what, is being expressed to us. Thank you for the opportunity.
Yeah. So Olga, thank you. Thanks for caring, and thanks for expressing the community. I would say first and foremost, as a parent, that decision, and Dr. Cook talked quite a bit about it today, but that decision, I think, is solely with the parent or the guardian of that student about whether they return to school live, face-to-face, or they do it online. I can tell you that there has been testing this summer of the summer school students. They've had positives. They've had positives in UIL athletics around the county. They've had an opportunity to practice with that, with quarantining those kids. I understand the trepidation or the concern or even fear, although I don't want us to be guided by fear. I understand that. I do believe that the measures are being put in place to safely allow us to live our lives, and that includes kids going back to school.
Thank you, Olga. Now we have Sarah Self-Walbrick with Texas Tech Public Media.
Hello, everyone. My first question's already been answered. Mateo asked that about how text return could affect our local numbers. So I just have one question today. We've reported 7 deaths in 2 days, which is very sad and alarming. What can y'all tell us about these deaths? And can they be traced back to that surge that we saw in June based on the typical timeline of COVID cases?
Catherine, you want to start?
I'll go ahead and start. There is a lag time between when we see increases in case counts and increase in hospitalizations and then increase in the number of deaths. Some of these deaths are individuals that have been sick for a long time, and some of that traces back to those initial surges. They trace back to early summer gatherings and get-togethers and vacations. And as long as this virus is going around, we need to continue to be mindful of who we're around, our social bubble, who we could possibly spread this disease to if we were infected.
That's all I have today. Thanks, everyone.
Thanks, Sarah.
Okay, now we have Grace Morris with KMAC.
Hey, good morning. Our question, we've talked a little bit about the Texas Tech students. What is y'all's message to them as they return back to campus?
So Sarah, or I'm sorry, Grace, I can help answer that question. It's a good question. So we're offering mass testing of all the students that are returning. Actually starts on August the 3rd. The TDM, Texas Department of Emergency Management, is coming out and setting up a testing center for all the students, the faculty and staff to get tested. That's a one-time test, and my biggest educational point that we need to push out is it is a one-time testing. That doesn't mean it's a free ticket to go to the bar and get infected or go out in public and get infected. It is a one-time testing. And so it gives us a potential to see who is potentially sick or infected at the moment, and we can take measures and stop it right then because we know who has it. And so, but we have constant messaging, and they're going to have constant messaging on campuses to make sure that people wear their masks, that they have social distancing, and that seating assignments or pictures or taking or all kinds of mitigation factors to slow down the virus on campus. Lots of work has been done at all the universities and colleges here in town to do that.
Perfect. And one more question. The city has obviously lost a lot of expected sales tax revenue this year and did get some help from the federal government, but how much of that is left? And again, are we pushing or expecting any more help from the federal government?
Yeah, so let's first of all talk about sales tax. Although we saw a significant dip in, I guess, what would have been March and April sales tax, the May sales tax not only came back, it was higher than what we expected this year and higher than last year. As we reported in our council meeting on the 14th of this month, we expect sales tax collections for the year to be very close to what we budgeted. So not significantly off. I think I in some ways answered your second question earlier but I'll answer it again. And that is that we're closely watching what's going on in Washington right now regarding negotiations about a fifth response to COVID. The CARES Act does not allow a city or a county to use those dollars to replace revenue. They really are to be used to help with the impact of COVID-19. So overtime, to help with your health department, to help your workers work remotely, and then they're also available for direct care, direct response to businesses, small businesses, and families. And so today, with a few exceptions, like the CARES Act had dollars for airports. Well, that went to the airport. That didn't come to the city. That can be used for revenue replacement. But what we think of as traditionally what the cities and counties have seen, you can't use that to replace revenue. That's something to watch in the next week and see how those negotiations go. That could change.
All right, those are all of our questions. Thank you so much.
Thanks.
Thank you, Grace. Now we have Brady King with Fox 34.
Hi, everyone. So the nursing homes in Texas and assisted living communities have seen a huge spike in July. So we're just curious, the state says they will do more tests, but what's the city doing regarding testing in those nursing homes and assisted living communities? Will they assist with that, increase testing, anything like that?
Yeah, we're working in partnership with both the facilities and Texas Department of Emergency Management. They're the ones that are coordinating the testing. So there's actually a contractor now that a nursing home assisted living can request testing. Even if they don't have a case, they can get their employees tested. So we're very supportive of that. And if we find cases within a facility, we're using that strike team from Lubbock Fire and Rescue and Health Department to actually go in and test residents.
Great, that's all I have. Thank you.
Thank you, Brady. KCBD had to get off the call early, but they sent in a question, and I'll read that now. Are the number of deaths in Lubbock County being counted retroactively to include the new criteria for deaths from the CDC this week?
Yeah, so let me start on that, and I'll let Catherine finish. The CDC has issued some guidance. I think the state has come out with some guidance. We believe that the way we've been doing it all along is very similar to what CDC has suggested and the state has suggested. We're counting COVID deaths very much like what would be reflected on the death certificate. Now, remember that we're reporting those deaths very much as they happen. There is a quality check process that goes along, and there's a gap in there that maybe a couple weeks before that death certificate is produced. And so if there is a small variation in the numbers, it could be related to that. But we don't sense that we're going to need to change anything. We've been very, I think our process has been from the beginning has been one that's been pretty thorough. And Catherine and Ron, you want to add anything to that?
I think you summarized that really well. We constantly first our goal is to get data out to everybody as quickly as possible. And with that, there's the caveat that we will need to revise data over time. We're constantly doing data checks, but I don't anticipate that we will need to revise any of our numbers of deceased individuals.
Let me just add, Brady, on a death certificate, there's several lines that there's the number one cause of death, and that's where we would probably put COVID-related illness or something like that. We don't ever put cardiopulmonary arrest. Everybody dies of cardiopulmonary arrest. So we would put COVID-related illness. And then there's other things that we can add to it that would say, they always ask, is there a smoking history? They ask if they were pregnant. Is it related to renal failure? Is it related to overwhelming sepsis? Or the cause of death may be multi-system organ failure as caused by COVID-related illness or COVID-19. So it's sort of a complicated picture. But the Bureau of Vital Statistics down in Austin is asking for that kind of information so they can clearly understand the depth and breadth of this disease and how it affects people.
Okay. Well, with that, we are done with this press conference. Thank you for joining us, and thank you to our panelists and our interpreter. For more information on COVID-19 in the community, you can go to mylubbock.us/COVID-19. Have a great week.
Thank you. Bye.